Hey, it's Matt from Aging Strong Personal Training. This is a Thursday therapy video. Today, I'm demonstrating how to use self-myofascial release for the hip flexor complex of muscles. So, self-myofascial release is really important to help restore the proper length, the proper mobility and flexibility of muscles so we can perform better and feel better. So, what the hip flexors do is they bring the hip in this direction here. So, this, as you can see, this is the position I would be in if I was in a seated position. Well, most of us are seated a lot throughout the course of the day, especially in this day and age with technology. So if we're seated a lot, the hip flexors are chronically short, and that becomes a problem and starts putting pressure on areas such as the lower back. So it's really beneficial to stretch those areas out, use self-myofascial release along with stretching. And like I said, help restore the length of not only those muscles themselves, but the connective tissue. So do self-myofascial release, easy for me to say. To do self-myofascial release for the hip flexors, I will use a foam roller. And so what I'm kind of focused on here is not only the front of the thigh, but usually I'm focused more up toward the hip. Okay, now there's a lot of different hip flexor muscles. Some of them go all the way down to the knee, but a couple of the main ones are up here near the hip. So one of the main hip flexor muscles originates right on the lumbar spine. So if that muscle gets tight, it tilts the lumbar spine and puts a lot of stress on the lower back and causes pain and discomfort. So to do self-myofascial release here, I will do one of two things. I'll either find a knot or tender area, right? And then I'll hold it in place for 30 or 45 seconds before moving on to another spot or two. Or I can gently massage it back and forth like this. And sometimes it's beneficial to get a little bit of what we call knee flexion, which would be this position here. That can help gently do a little more for you as well. So it's not only beneficial to be up near the hip, also sometimes I'll tilt to the outside like this, and this is getting a different hip flexor, okay? The hip flexor I'm hitting here is called the TFL, which is an acronym for tensor fasciae lata, and that muscle, that tensor fasciae lata muscle, attaches right to the IT band, and the IT band is a culprit oftentimes when it comes to knee pain. So if I can stretch out this TFL and get better extensibility there, it'll help take stress off the knees. So for anybody who has the situation where the knees kind of come together when they squat, this can help alleviate that and help perform better and feel better. So there you have it, self-myofascial release for the hip flexors. Thanks for watching, and visit our website at agingstrongpt.com. Now, if I can find my remote control, I'll be in good shape. There it is.